Estamos aqui no Pessoas de Valor hoje com mais uma entrevista especial. Estamos aqui com o Dr. Stephan Hausner, que é um médico alemão que trabalha com constelações familiares, especialmente na área da saúde, sintomas e doenças. Ele está aqui no Brasil, dando um seminário, vários seminários, América do Sul inclusive, e nós estamos aqui, tivemos a oportunidade, eu estou aqui, o Ari veio, para que a gente pudesse fazer uma entrevista com ele, que é uma autoridade, uma celebridade mundial nas constelações, especialmente na área da saúde. Dr. Hausner, welcome. It's a pleasure to have you here in Pessoas de Valor. We always try to interview personalities in health, and you are an expert in family constellations, especially in health matters, symptoms and diseases. Could you present yourself and do what you do? How long have you been doing this? And what are your experiences in constellations with health?
Well, my first interest in the field of illness and health actually was traditional Chinese medicine. And after a while, I had to realize that I'm not Chinese, and I will not understand this method on a very deep, on the deepest level. But it has already influenced my way of looking at illness and health, as in traditional Chinese medicine. It's about through a special way of diagnostic. You look basically what is out of order in the body, and then by some recipes, by some interventions, you try to regain order. That basically it's not so much about the constellation, it's more about an inner change that is happening, which is necessary for the healing, in the sense of kind of changing inner images, changing an attitude towards life, changing my relationship towards the illness, and that in a certain way of widening my perspective. No?
Do you think the difference between these patients, that one was not healed but felt emotionally, and the other didn't feel very much but got his symptom better, the difference between them is the understanding, the emotional or cognitive, or both? Understanding what, or the new order in the system? How do you understand this?
To be honest, I do not really know. And to be honest, I still think that one problem in constellation work is that we do not know what we're doing. Today, I think it has a lot to do with responsibility, in the sense of the ability to respond.
The client.
The client's responsibility. Because today, actually, I see health as the ability to respond. We are exposed to many influences, living situations, toxins, bacteria, viruses, and also the family, of course. And in a way, the healthier we are, the more creative is our response to the conditions we're kind of living, or to our current living situation. And in a way, I see the participation of a constellation workshop. My aim is to increase the ability to respond. Means on one side to kind of destroy illnesses that kind of limit us, destroy inner images that kind of limit us, and replace them by images that open us up, that help us to learn and to be more creative in our living situation. And I would say, and I connect this to movements in the body, and I would also connect this to movements on the soul level. and also, of course, to the relationships we're living in.
When you say this, the ability to respond, the responsibility of the client, when we are aware of our paper, our functions, how do we respond to our lifestyles, it's okay. But in the case when you identify in constellation, identification to ancestor, and the client is repeating a movement, what Hellinger says by blind love and things like that. How is the responsibility in this case? Because sometimes the client doesn't understand how it works.
Exactly. I mean, mainly the problem is, as you mentioned, the blind love Bert Hellinger was talking about. Mainly the thing is that it's our unconscious movements that lead us to illnesses and symptoms, and basically the way is through constellation work we bring more consciousness to the client
of his paper in the family system.
You mean of his role in the family system? Exactly. We need to, I think, when we apply constellation work in the field of illness and health, we basically also need to understand the concept of trauma, because all identifications, all repetitions that we kind of, or as you say, we take on roles within the family system that are not our roles. Basically, the background of this, why we do this, is because there has been trauma. And trauma basically means that in the moment I do not have enough resources for a creative response. This is why I need to close down. We also say we dissociate, we get out of the relation, but by this we actually make our world smaller as it actually is. No? And this is a survival mode, and this is very intelligent on one level, but in the same time it's also a limitation. Yes. And then we keep on going with our life. At a certain moment we notice that we want to expand again, we want to open up again. No? And for me, this is why I like constellation work so much, because every constellation that I do for myself, or also that I watch, basically is the invitation to open up for a new perspective. And I think in this opening up actually happens the healing. Yeah. And this can happen when I do a personal constellation for myself, and this can also happen, as I said before, when we just are watching constellations. Yeah. So in that way, for me, learning and healing and growing is the same movement.
And yes, I agree totally. And it's very interesting to see that this trauma that blocks us and makes us ill, sometimes they are transgenerational traumas. And to be aware of this, of our role in the family system, is very healing also. Mm-hmm. I am also an homeopathic and acupuncturist doctor, and when I met family constellations, it got bigger and helps better to help people make movements to the big, not to the to the most. Mm-hmm. In this time, we are worldly passing through a difficult time, and I will ask you about your perception of the pandemic as a global disease. It has a function globally and individually. How you, as a health practitioner, see this pandemic that goes for 2 years now, and without perspective of getting solved? How you see this?
Well, the first thing I would like to say is that my perspective on the pandemic is that it's actually the first time that we as a worldwide community are clearly facing the same problem. We have other big challenges like the climate change or the extinction of the species, but this is more subtle. And some people are very much already affected by the climate change. Others don't feel it so much or don't let it so close to them. But the pandemic, the corona illness, COVID, we are confronted, all of us, and we cannot kind of close our eyes in front of it. And I think it's a serious illness, is clear, but already, as I said in the beginning, on one side there is the virus, and on the other side there's our immune system. And health means the ability to respond, as I said already before. And to be honest, I think blaming the virus and just looking at the virus as an enemy is not the most creative answer. Yeah. Of course, when you are personally affected, it can be very traumatic, and it can be very difficult, and of course for the families who suffer from losing friends and family members, it's very intense. No? But in general, I think we do not use our potential, our full potential, to find the most creative response to the pandemic. And by that, somehow I also sometimes have the feeling we miss the chance to really stand together as a world, to come together as a community and take responsibility for this worldwide challenge that we're having as a global community. Yeah. This is basically how I see it, and this is what makes me the German word is betroffen, that makes me kind of also sad, no? in all that.
Ok. Vamos fazer um pequeno intervalo e Pessoas de Valor volta já com essa entrevista interessantíssima com o Dr. Stephan Hausner, constelador na área de saúde, sintomas e doenças.
Olá, sou a coach Renise Gomes. Minha missão é desenvolver o potencial das pessoas para levá-las ao melhor delas mesmas. Estou com um programa de desenvolvimento pessoal e de liderança, Líder Eficaz, feito sobre medida para você. Faça contato pelas redes sociais e o site Coach Renise Gomes.
O Célula Mater foi criado há 30 anos pelo Dr. Carlos Eduardo, um dedicado biomédico que decidiu usar todo o seu conhecimento para cuidar melhor das famílias da nossa região. Ao longo das décadas, o Célula Mater cresceu e conquistou a confiança da população com seu atendimento humanizado, virando referência de qualidade em análises clínicas e de precisão nos resultados de exames laboratoriais. Laboratório Célula Mater, presente no momento em que você mais precisa.
Existe um bebê que é especial. Está sempre na moda, bonito pra você. A mamãe e o papai, ele quer agradecer pelo banho de loja da estação do bebê. Roupinhas, acessórios, carrinhos, enxoval, toda a decoração da estação do bebê.
Rua Carvalho de Mendonça, 251 Santos. Estamos atendendo. Ligue para 3302-1970.
O seu bebê feliz na estação do bebê.
Estamos voltando agora com Pessoas de Valor, entrevistando o Dr. Stephan Hausner, constelador familiar na área de saúde, doenças e sintomas. Dr. Hausner, could you explain to our public how do you understand the function of diseases? Why do some people get sick and others in the same family does not get, living in the same space, living in the same family? What do you think that causes people to get ill and others don't? It's only a choice, lifestyle? What else do you see?
Well, mainly, of course, coming from alternative medicine, we see symptoms or illnesses as a call for a change. I today, after 28 years now of applying constellation work in the field of illness and health, I do not discern anymore between a question and a symptom or an illness, no? Because for me, behind this is the same, basically there's the same principle, no? As I said already before, no? And the principle is that our perspective, maybe I can show it like this, actually is too small, no? And if I am sitting with an ongoing question and I cannot find the answer, mainly the reason, most probably the reason is because the answer is outside of our perspective, no?
Conscious.
Maybe out of our conscious, exactly. Thank you. And it's actually the same when I say if I'm searching and if energy is starting to circle for a long time in the same direction, I think this causes a manifestation, and then we will have a symptom. And for me, it's not so much interested anymore where the illness or where the symptom is coming from. For me, the main question is what is helping. And helping is, as we said already before, is that our perspective is changing. And of course, widen the concept. No? And of course, if we, and this is why I work with constellations and why I love it still so much, is because every constellation is basically the invitation to do this movement. Mm-hmm. And of course, I'm aware that afterwards we are in a bigger frame. No? And at a certain moment, again, we are in the similar movement and we're starting to having a question. Outside. And then again, we have to look outside again. No?
So it's a movement.
So the healing movement is basically a movement of expansion. Yeah. And of course, in really coming back to your questions, if we are exposed to viruses, if we are exposed to critical situations, on one side, of course, there is the invading energy from outside, and on the other side, there's our response from inside. Yes. And the more flexible we are, the healthier we are, I would say, and the more creative, as I said already before, can be our response. No? So, I think. And of course, we as we work both in the alternative field, we also know about the importance of preventive medicine. No? So I myself personally, regularly, I have some craniosacral sessions. I go there whether I have a symptom or not. I don't care. Craniosacral, yeah. I don't care, no. But I give my body to the hands of a craniosacral therapist in order to see where there are fixations and how can we kind of deblock these fixations so that my body is a healthy response to whatever situations I have to go through.
Because we, as therapists, we need also to be treated. Exactly. We can not only treat others, but if we do like this and do not look at ourselves, we are saviors, not therapists.
And if we are too fixated, we do not have creative answers for the questions of our client.
How did you meet Bert Hellinger? Was with him that you started the study of family constellations? And we don't have in worldwide many constellators that are specialists, if I can say that, in health matters as you. I don't know other to speak so. How did you meet Hellinger and got interested in this?
Well,
historic.
Yeah, fine. I met Bert Hellinger when I worked as a homeopath in the practice of my father-in-law, and Bert Hellinger came as a patient.
He was a patient?
He came as a patient, yes. And this is basically how we met. And
which year was that? Which year was that?
I don't remember exactly the year, but in the year 1993 was the first time I decided to go to a workshop with him. And of course, and I didn't first. I felt very shy in applying this work.
It's very strange. We can say so. It's different.
Yeah. I felt also because me personally, I'm not a psychotherapist. No, I come from alternative medicine, but in that way, it was kind of also clear to me that I can only apply this work in the field of medicine. This was my space. This was where I was at home, and then from there I could investigate and develop the work I'm doing today.
As a therapist in symptoms and diseases, but sometimes people arrive with mental problems and mental symptoms, and we as therapists know that it's one thing only. Did you have easiest way to work with diseases in the body or in the mind? How did you work with that? Because now you grew and treat any kind of problems people bring you.
Well, I don't work with all problems, especially when it goes into the field of psychosis. I today prefer to work with family members, not with the client itself, or at least we have a very clear interview and process of decision who is going to be present in the workshop and who is going to work. But mainly I would say that my work actually is body work. Because for me actually the body of the client leads the constellation. That means the client goes first and I kind of just follow. And for me the nice thing is that it is not just a one-to-one work where I have to convince maybe the client from ideas, perspectives I gain throughout our process that could maybe be helpful. The nice thing is in a group setting that me and the client, we can look at the third element, I mean the constellation. And for me the constellation is kind of kind of a supervision process of my therapeutic work.
And you said we really sometimes don't know what is happening there. And I read in your book that you say that in a constellation many things can appear. And sometimes we don't know what will be useful to the disease of the client. How today, after so many years, how do you choose? Do you feel with your body? How is your process?
Well, I'm even saying that we do not at all know what we do when we do constellation work, because we cannot understand this phenomenon of representative perception. And so if I rely as a therapist just on the constellation, I would say as a constellation facilitator I have a problem, because then I have to rely on something that I do not know what it is. No? But I also, being trained a lot in body work, the thing I rely is the body of the client. And it's the same, like you see, the constellation kind of is like something demonstrating from outside. And for me, it's not so much important. It's not so much important what is this. For me, important is how is the response of the client to that body language. Exactly. No, because also a sustainable solution can only be a solution can only be sustainable when it's happening in the body of the client. So my focus is mainly the body of the client and not so much the constellation. And the body of the client tells me, with this information I have stress, there I need support to integrate, and with this information I'm fine, I can deal with it. And with this, then I do not need to work. So in that way, it's kind of a co-creation between what is the information that is unfolding in a constellation, but the most important thing is the response, how the client is responding to that, and where the response is limited, kind of fixated, then it can always be helpful to support the client, to help him relax and open up. No? So in that way, I see constellations work mainly as body work, or you can even say as trauma work.
It's a very interesting view, and I agree with that, because there are some things that help us in therapy. Constellation is a field information that is here. Morphogenetic field, you can call as you want. Body language that brings us the response of the patient, and the symptom itself, the way the client gets ill, says something about his traumas and his family field also. So integrating these all, I think gives us the answer. Yeah. Is that?
Exactly. Well, today I even say a constellation is nothing else than an answer to a question.
Yeah.
And in terms of or related to a question or a problem and time, I'm a friend of Albert Einstein, because he says, when I have a problem and I have 1 hour time, I use 59 minutes to find the right question.
Yeah.
And I think this is a principle. This is for me also alive in constellation work, because of course my clients, they come with symptoms, and then first we need to find out what is the right question in order to treat the symptom. No?
That will help him.
Exactly. And once we have found the right question, it's just a little step to find the constellation that kind of withholds the answer to the question. And then the therapeutic work comes into place, because the client needs support to integrate the new thing. And this sometimes takes even more time than the constellation itself. No?
Yeah. Well, very good. I'm very thankful for your time here and for knowing you and your work. It's an honor for me and that we are attending here a seminar. And unfortunately, we have time and I have to close here. But thank you very much.
I am very grateful, and I'm very grateful for the invitation. Thank you for this opportunity.
I hope there are others.
Me too.
Pessoas de Valor vai ficando por aqui. Se você quiser assistir esse programa e os outros programas anteriores, já são cerca de 150 programas nesses anos aí de Pessoas de Valor, veja no YouTube e no site pessoasdevalor.com.